Hey, welcome to my chat. Next month, I'm going to do a special giveaway, okay? Because it's over 200 members. And I think what it's going to be several things. It's going to be a Treasure Art Studio diamond painting. It's actually, you're going to get this one, okay? Because I'm going to order it, and it's going to be part of it. And I got these trays coming, but I will do that on the first. But just let you all know, if you want a Treasure Art Tribe DP, guess what? You're going to get one. This one I'm keeping for myself. I will be ordering this one. I don't know how long it'll take to get there, but I'm going to order this one. And the winner, I think if I contact them and I go to order it, I think they will let me send it to the winner. You know, when I purchase it, and say, I don't want it, send it to me, could you please send it to them? I see no reason why they can't. I'll find out. And we're going to do a little W.I.P chat. Let's get everything together with my pink little bag, which I love. I love this bag. Get the pen out. Get my board out. I'm going to be, oh dear. Excuse me, Mom. Where'd it go? Jiminy Cricket. See, I'm working on her squirrel. So now I'm a squirrel, right? I'm gonna goof. I don't see it. It bounced everywhere. There was a placer. First thing I'm going to do is I'm going to take off this. I'm going to put it in the bag. Don't want to lose my pink. That is so close. I had to, you know, I got a new lung doctor, and I do have spots. They're about 7 millimeters, but they haven't grown. They haven't grown in 5 years. It's not cancerous. And I found myself trying to reassure my lung doctor. I says, I've had this test. I have it every year. They have not grown. It's not cancerous. I promise. He says, I don't care. We're going to do it again in 3 months. So he's sending me on the 15th of next month some kind of test. I never had that test before. That's the one lung test I did have. I've had the breathing test. In fact, every time I go there, he does the breathing test. And wouldn't you know it, when I went in there for the test, what happens? She gives me the machine, I'm breathing fine, and then she tells me to take a deep breath, and I decide to go into an attack. And I always get air. My attacks are like, I start coughing, I've had attacks when I was doing my V.I.P. Have you ever jogged? You know, you've been jogging and at the end you're tired and you're, oh God, don't send yourself into breathing really heavy. That's my attacks. I always get air. Even during the attack, when my oxygen level was 98. I tell you, it's really ironic. I'm 63 years old. I haven't had a cold since I was, what, 17? I haven't had the flu since I was 20. I didn't even see doctors till I got to about 50, except to have my kids. I was a CNA, which something I'm kind of proud of because I started doing that work before there was such a thing as CNA. I was one of the first groups ever to be certified. When they passed along in the late 70s, I believe it was. Anyways, I do go in for the biopsy Monday, and I guess I really should do research because I've seen one girl say now it hurts and it's painful. My mother's telling me it's not. They're going to numb my breast. They're going to stick a very long needle in there, and they're going to take some of it. But I asked the doctor, I says, why do that? Why don't they just open me up, take it all out? One time instead of doing that. I don't understand it. Because if it's benign, I still want it out. Because it could also turn cancerous. But you know, folks, I'm a Christian. And the bottom line is, if I lose this fight, it's only my body. That's all. It's only my body. I myself won't die. I will be going to heaven. I know Jesus died for my sins. I accepted him as my Savior at the age of 13. So I know where I'm going. So, and as a CNA, and I probably see more deaths than most doctors. I've been in many patients' bedside when they drew their last breath. Something I was very proud of, that when I worked, I didn't want anybody to die alone. So if I had a patient I knew they were on their way out, I would be in their room a lot more often. I wasn't always get to be there when they took their breath, which would be a disappointment. Last breath, it'd be a disappointment only because they would die alone. Sometimes the family was there. I didn't worry about them. I would go in there still there, but I would try to leave the family with the patient to have their time with them. When a patient died, I mean, I'd have them looking so good. I'd wash them head to toe, then wash the hair, I mean, brush teeth. I would have them really nice, and I always made sure they had that thin in the neck so the jaw did. And I don't know how many times when the motion come in, oh, it's looking so good. What? So I've had a lot of compliments on that. I did get burned out on it though, because I was taking care of my cousin's mother-in-law, and then my husband passed away of lung cancer. That will be in another whip and chat. I got burned out. I could not, see, before I could be with a patient when they passed away, do what I had to do, go to lunch, eat, and there I could separate them. I could go home, I would be crying because there's a line. You can't get overly attached, but you also can't be cold. Yeah. I'm not saying I was always successful. 4 or 5, I'm 63 years old. I remember some patients like my little Frank. Yeah, he hit every single CNA out there. He'd hit it, but he never hit me. He would do anything for me. He refused to take his meds. Else I had to say, Frank, won't you take your meds? No. Well, won't you take them for me? Yeah. He was really ornery, but that was my baby. Pengelly. I was 19 when I took care of him. Sweetest little guy. Little trouble. He didn't give you trouble, but he was dickish to take care of. And then my mother-in-law, and so there's only been like 3 or 4 that I can really recall, really tell you about them, because they made a real impact on me. Okay, let's start this. I'm talking about breast cancer, and it is so important. One doctor actually had a couple of years ago, my mother had it, my aunt had it, they beat it. They caught it in early stages. I says, no, I don't need it, no, I don't need it. Then I decided, well, maybe I should. I wasn't having any symptoms. There's no bumps on my, if you're a man, I'm sorry, on my breast. There's no discharge coming out of the nipples. There's no, I'm not having any symptoms of breast cancer. So it was found during the first mammogram. It turns out I got some calluses in the breast. If they go to do surgery, I'm not asking them anything. But I don't know, because I got them on both breasts, and if I haven't removed the callus, I might be a little lopsided. And apparently it was hiding underneath there. They suspected something, so I went. The mammogram does not hurt. It's just basically they take your boobs in a machine and they flatten it. I didn't know they can get the boobs so flat. Okay? That's it. How to do small-breasted women, I asked her that. I says it must be really difficult because you got to put it on that thing. It's a machine and it has this flat surface which you put your boobs on, has this top and it comes down, and it's really pain-free. It only takes a minute. But my advice to you, if you're going to get one, don't wear deodorant. I mean, I got up that morning, I took a shower, put deodorant, only to get there and told that I had to wash off my deodorant, because it could give a false reading. So when I went in to do my second mammogram, praying that that's what it was, I took a shower. I did not put deodorant under my left arm. Went down there. They did it. I had a lot of trouble. I kept waiting for community, thinking it had to be, quote, approved. Let me see what color I need. Let's start with P. 3865, here we go. So I waited and I finally called up my doctor, my GYN, and I said, I'm really upset because I talked to community, they are great, they never got the referral. She says, we don't need one. All you got to do is, I thought she was a little rude. We don't have nothing to do with that now. You have to call this number and make it an appointment. Well, I called that number. The woman was extremely rude and actually kind of scared me, because she's like, well, we got to look at it and we got to see. We got you for the 28th. I can't promise you're going to get it. That's tentative. We may not be able to do it. And the way she said it, I said to her, oh, so you mean to tell me if I have cancer and you decide you can't take a biopsy, means I can't get a treatment of any kind without affirmative diagnosis? So you tell me basically gonna die. Oh, no, no, that's what it says. I says, well, that's what it sounds like to me. And I learned through my son, sometimes you have to fight for yourself. I fought for my husband. I had to fight to get my autism son diagnosed. I know how to fight the medical system, and I know a lot of times in working in nursing homes, you got to pressure the staff. Laid back family members, guess what? The pain in the butts, families, you're going to go attend to their loved ones faster because you don't want to hear it. And you put the laid back ones, you do the care, but you kind of put them in the back burner. You go do them first, then you go to them. So I know, and so I kind of had words with this Debbie. And she promised to call the next morning. She didn't. I called her. Oh, I left a message on your phone. We are going to do it. You got to be here at 9:30. Well, she didn't leave no message on my phone. But I'm not going to argue that point with her. I got it done. I called my GYN and I says, okay, I'm having it done on the 28th. I need to make a follow-up appointment. I guess 2 weeks after that. Oh no, we'll call you. Well, I got news for them. They don't know me. I'm not going to take a call if it is cancer, you call me, and if it's not cancer, you don't call me. That's not happening because, frankly, even if it's not cancerous, I want to talk about getting that tumor out of there. You know, one way or another. I mean, what do I have to do? Take a knife and take it out myself? No, I wouldn't do that. I'm joking there. And so it's the 28th, and you know, I did some research. If you're in the early stages, you could pretty much beat it. It also said, as far as vasectomy, that is no guarantee you're going to get the cancer out, and refusing to have it done or not is a personal choice, and that it's not going to worsen your odds one way or other. I suspect if it is, I will, of course, have surgery. This is being pre-recorded because I don't know how I'm going to be up Monday. I know I'll be sore, probably too sore to, so that way I can just load this up. And I even checked on, you can check on YouTube, there's a lot of good information. I was shocked to find a lot of 20-year-olds, 30-year-olds getting breast cancer and how they got it. And they weren't stage 1 because they didn't have a mammogram. So, you know, it's important to have it done on a yearly basis. That way, if you do get it, they can catch it early and do something. All the sites I checked are saying the same things before going in to find out yay or nay, that you really need to look at your options, what you can have, so you know, instead of, because at the initial there, I didn't even ask her if she thought it was cancer. I didn't ask how big it was. I was just too much shock. So when I go back, I'm actually going to have a piece of paper with me with the questions that I want to know offhand. Okay, this glue. Uh, to answer. So it's really, really important. I can't stress it, SE, I can't stress it, Diamond Art Addiction, Rachel Ray, Crafting with Christy, you know, all of you. Just, you need to go in and have one done. Do not let your doctor say, oh, you're too young, don't need it. Insist on it. Fight for it. If they won't do it, I don't know about over people in England and Canada, but here in the United States, we often have health fairs where they do it. If you get health fair and they're offering it, then sign up for it, do it. We have it here once a month across the street. How I got mine is when I went to the doctor telling him I wanted that. I wanted it. He referred me to GYN. Okay, I went to go to the office and they happened to be had one right outside the door. So I saw the doctor and she sent me out there. Apparently she does it once a month or I don't know. And that's what started the ball rolling. My poor lung doctor, he thinks, oh, we got to make sure you don't have lung cancer too. I says, I ain't got lung cancer, I promise. I realize they're big, but they're benign. And I want surgery to move them, not in the lungs. But if you want me to go in 3 months, I will. But I says, you know, after watching my husband, I says, I'm sorry. If I were to get lung cancer, I would not take treatment. Lung cancer is almost impossible. Well, I got people there, and I says, Doc, I says, if I've got breast cancer, and they tell me it's in stage 4, guess what? Stage 4 is the last stage. I'm going to say, thank you for your time. No treatment. That's it. I am not willing to go through chemo, mastectomy, throwing up for a few more months. Well, I've got people out at stage 4 there. I says, yeah, but that's there. And I says, I've already made up my mind. Something is quality of life I'm after, not quantity. And I want them telling me, oh, well, we can give you a few more months if we give you chemo. A few more months of what? Throwing up, your hair falling out? However, so that's my decision on that. I will not allow any mastectomy to be done at all. It ain't happening. When I die, they go with me. I grew when I was a kid, puberty, and by God, I am going to die with it. That's that. But I don't know what stage it is at this point. He goes, will you start treatment if it's stage 3? I says, that remains to be seen. I don't know. I says, it depends on what the doctor's telling me, on how aggressive it is, what my chances are. I says, it really depends. But I says, it's early stage, it's great. I gotta be, and it'll just be surgery to remove it. I'm going by what my mom said, and by my research, they would immediately do surgery, remove it, take part of my lymph nodes out to test. If it's gone further, then I would go to radiation. When I get that surgery, it means to be safe. I mean, what happened the old days? The doctor diagnosed, he did the surgery, he did this. So I guess it means I'll get a call. You see, I will find out tomorrow how long it takes for them to get it. I'll be calling them because I still want to follow it, regardless. Cancer, I want to follow it. That's the name of that too. So what I'm telling you, if I manage to scare you by talking about this, good. I want to scare you right down to having a mammogram. Because I tell you, the worst is not knowing. The worst is not knowing. I did another channel called My Breast Cancer Journey. I'm not deleted. It was just one I was going to do just to talk about it, not actually for people to see. I decided it was stupid. So if I can figure out how to delete that channel, it's going to be deleted. That is going to be basically all I'm going to say in the WIP for today, because I really don't know what up, and I'm not going to know really even Monday. All I'm going to know is I'm going to have the surgery Monday. And I tell you, it is worse not knowing than knowing. Because at least if I know if I got cancer, I can do something, whatever, make decisions, do whatever. It's not knowing and being in limbo. I think that's worse. I honestly do. I mean, when I got originally got my spots in my lungs, I thought they were cancers. I tried to get them to do a biopsy, and he said, "Oh no, they're too small. It's impossible. This is what we're going to do." You know, and I understood why they didn't. But the lung doctor is saying, "Okay, we're going to do this in 3 more months. And if it's grown, I'm going to send you in for a biopsy." I said, okay. I found myself trying to reassure him. It's not going to grow. It's not to say they won't, because benign cancer, tumors can later turn into cancer. But they've been there for 5 freaking years or more. And you know what? They haven't grown. And I probably have actually had them in there longer than that. Like I said, I wasn't a person real good going to the doctors. I never had any symptoms to go to the doctors. And then when I hit 50, well, no, I was 58. And I started coughing all the time. I said, "Oh, it's a smoker's cough." My boyfriend bugged me and bugged me and bugged me. So I actually went to the emergency room. The shots, which they did misdiagnose me. Tried to say I had bronchitis. I didn't have bronchitis. They sent me to a lung doctor who sent me in for a breathing test. She sent me in for an x-ray. Once she got the x-ray, she says, "Well, you got emphysema. You got 40% lung capacity. Well, apparently that's all I need because every time I go to the doctor and they take my oxygen, it's 97, 98. I think one time it got low, and I said, just hold on a minute, I'll get it up. Because I can tell when it's low, and my action is, I go outside, I kind of put my lips together, suck in the air, breathe out, suck in the air. I kind of exercise it. You know, a lot of times what they do, I mean, they sent me to the heart doctor, and he says, oh, your heart's fine, except you got a little bit of hardness around your heart. It ain't about nothing, but you do need to start exercising to get rid of it. Come back, see me in 9 months. If it's still there or if it's worse. I says, well, what can you do? He says, a whole lot. He says, we can give you some medication that will take care of it. Well, I says, I'll do the best I can, but I can't be really exercising a whole lot with 40% lung capacity. It sends me into an attack. So I do try to walk. I wish he just gave me the medication. Not much so much medication ain't funny. I guess it happens when you start to get old. Problem is, I maybe get old physically, but mentally I'm not. I still like stuff that I liked when I was young. I do like country music. Mainly, the only one I like is Johnny Cash, mainly because, well, let's put it this way. Cash clan here, yes, we were related. But between he was pretty stuck up. He kind of forgot where he came from. It's not like he came home over for dinner. We did get to see his concerts free. We'd go backstage, the manager would come out. He'd pull us out, we'd go into the dressing room. He was kind of stuck up, but June was just as, you know. My sister went there one time, and there was a little old man really waiting to see Johnny Cash backstage, and been talking to Susan. And when the manager come out and says, we got family, we need to pull out of here, Susie and Patrick went to go, and Patrick looked at him and said, this old man, he loves Johnny Cash, can he come too? And they let him. Susan said, told me that he was, what are you burning?